Hello, this is Andrew Chu from the Institute for Public Policy and Economic Development in Northeastern Pennsylvania. It is Wednesday, August 5th, and I'm here today to bring you a quick video update with some of the latest data on the spread of COVID-19 in our region and what data we're going to be looking at going forward. So here we see a couple maps of statewide trends at a couple different time points since May. And what these maps are showing is the week over week percent growth in the rate of COVID-19 infections per 100,000 population. So in other words, how rapidly is the COVID-19 disease spreading and what does that trend look like over time? And you can see back in May, there were fairly high rates of spread across the state indicated by the darker colors. The southeastern portion of the state, including as well as Lackawanna County. Since then, we've seen the kind of statewide center of COVID-19 cases move westward. In early July, you can see those dark colors in the western part of the state around Pittsburgh. And in our most recent data, which goes up to August 3rd, we're still seeing nice light colors in the eastern half of the state, indicating that the epicenter of infections in the state is not in our region. And when we look at this same data trended over time for Lackawanna County, we do see kind of that same trend. Back in April and May, we saw pretty rapid growth in the number of cases. But since then, the week over week increases have been 4% or less every week since the end of May, which indicates kind of that while the concerns about COVID-19 are still with us, the spread and the growth are much slower, indicating that some of the measures that we've seen taken are working, and this is a generally positive result. In Luzerne County, we've seen mostly the same, though you'll notice a small bump at the end of this data, just that last week ending August 3rd, a 6% growth in new cases in Luzerne County relative to the previous week. That was the biggest uptick in the rate of new cases since early May in Luzerne County. So this is definitely something we want to watch out for and monitor closely. One other data point we wanted to update you on is the cumulative positive test rate, what percent of all COVID-19 tests come back positive. This is a number we like to see nice and low. A lot of public health officials nationwide and around the world have suggested that 5% is what we'd like to see, because that means that we're testing enough people, that tests are widely available, and that there aren't a huge number of cases that are going undetected. And we've seen some positive progress in this statistic also, going from 25% back in May down under 10% pretty consistently. We're around the 8% point. Now we would even like to see this number get a little bit lower, but we definitely have made progress, and we're going to keep watching these numbers as well. So what are our takeaways? In Pennsylvania, the COVID-19 epicenter has shifted to the southwestern and south central parts of the state primarily, and that northeastern Pennsylvania has experienced a slower rate of the spread of COVID-19. That said, we're not out of the woods. Luzerne County did see its fastest rate of new cases since May, just in the week that ended, the 7 days ending on Monday, August 3rd. This tells us that COVID-19 is still with us. It's still something we need to be monitoring and taking action on, and letting data like this drive decision-making at all levels. And experiences that have been seen in other parts of the state and other parts of the country show that we need to be vigilant in staying on the right track. If you're interested in more data and information on COVID-19 and its impact on our region, the Institute is in the midst of a comprehensive series of studies, several of which have been published already on our website, institutepa.org. You can also hear more about our Institute insights on COVID-19 on our social media. I'd like to thank our sponsors who make that possible um, for their support of that very important research. And we'll be sure to keep communicating new data and insights to help support our community in its recovery and revitalization from the COVID-19 pandemic. Take care and stay safe.